The mouth-body connection is a term that we're using now because we've come to realize that the head is not cut off and over here. The head is on the body and the mouth is a part of this system, and it's all interconnected. So the bacteria in your mouth can certainly affect your overall health, and it is the gateway to good health. First of all, you need your teeth to chew. Digestion starts right here in the mouth. So if you are losing your teeth, you don't have your teeth, you can't chew properly, if things are hurting in your mouth, then you're not starting the digestion process. And when it gets to the stomach, you can have stomach issues. Also, the bacteria in your mouth can get all over your body, and it can cause issues and set up risk factors for diabetes and heart disease and many other things. Inflammation in your mouth is very important to control. We've come to realize now that any inflammation anywhere needs to be controlled. So we can do this, you can do this by brushing and flossing very effectively and visiting your dentist. That's how we keep inflammation under control in your mouth, and that'll help your whole body. Let's start with a proper way to brush your teeth. I recommend that you brush your teeth 2 times a day, once in the morning and once before you go to bed at night. So let's learn how to brush and floss your teeth. The first thing you need is a proper toothbrush. There are lots of toothbrushes out there to look at and to purchase, but what you need to look for, the most important thing to look for, is a toothbrush that has soft bristles. Also, you need to watch for the size of the toothbrush. You don't need a toothbrush that's very big or very long because you're not able to brush your whole mouth that way. So you want a brush that's smaller, the brush head to be smaller, and you'd like to have soft bristles. Let's take a good look at our mouth here. As you can see, there are a lot of areas in the mouth. There are a lot of nooks and crannies. We have pits on the top of the teeth, and we have this area of pink here, which is our gum. Bacteria or plaque tends to collect around this gum line in all these nooks and crannies and in the tops of the teeth where there are a lot of pits and fissures. So we need to learn how to brush and remove all this plaque and bacteria that gets around our teeth. So let's take a look at this. You have the back side of your tooth, you have the flat part of your tooth, and you have the front of your tooth. And this is also on the inside of your mouth, the back side, the flat side, and the front side of your tooth. So you need to be sure that you get your toothbrush around all these areas. The proper way to place your toothbrush is at an angle. And you put your toothbrush at a 45-degree angle, angling it into the gum line where all this sticky plaque tends to collect. You use a very short back and forth or circular motion, just like this, and then you sweep the plaque away. So let's review this again. It's a short back and forth, circular back and forth motion, and then you sweep the plaque away. The improper way to brush is to brush both arches at the same time. This only takes 30 seconds, but it doesn't clean your mouth very properly. So what we want to do is to have a pattern. It's always good to have a pattern or a routine so that you don't miss any areas of your mouth. So if you want to, you can start in the back and use these short back and forth strokes and a sweeping motion all the way around. Then we have to brush the insides as well with a short back and forth, again, a sweeping motion. When you get towards the front teeth on the inside, it gets a little difficult, so you use the toe end of the toothbrush to scrub up and down on the insides of these front teeth. And then you go short circular back and forth strokes and then sweep. Okay, now that's the top arch. We have the lower arch to do, and there's a little bit of a problem. The problem is we have our tongue in the way. So how do we get around the tongue? And this is why it's good to use a smaller head toothbrush. So you can get all the way in the back and push that tongue out of the way. And again, we do our short back and forth circular strokes and then sweep the plaque away. When you get to this area here, again, we use the toe end of the toothbrush and we brush up and down. And bacteria tends to really collect in this area. The tongue is in the way and food debris gets down in here. So it's a good area to pay close attention to. Short back and forth strokes and sweep. Okay, so we've brushed all these areas. We've brushed the outsides and the insides, and we're left with the tops of these teeth. Now, one thing that you have to make sure when you're brushing is that you don't overbrush. You don't over scrub the gums. These gums are soft tissue, and if you use a very strenuous, hard back and forth motion, you can wear your gum away. So it's very important that you don't overbrush. However, I'm going to give you permission to scrub away at the tops of these teeth because you have a lot of pits and fissures here in these teeth and you don't have any gum up there. So you have my permission to scrub away to remove food debris and plaque from the tops of these teeth. Now, as you can see, this is a little different than just brushing both arches and running out of the house. This takes a little bit of time, and it should take you between 2 to 3 minutes to properly brush your teeth. It's important that you, first of all, select the proper toothbrush. Secondly, brush all areas, all surfaces of your mouth. Don't overbrush, don't over scrub, and most importantly, have patience because it will take between 2 to 3 minutes for you to effectively clean your mouth. And if you do this, you'll not only have good oral health, you'll have good overall health. Now we're going to learn about flossing. We've already learned how to brush our teeth. And there is an area in your mouth that the toothbrush, as hard as we brush, we can't reach it. And that's why we need something to get in between the teeth to prevent cavities and decay from happening and periodontal disease in between the teeth. So this is why we need to use dental floss. There are lots of dental floss available out on the market for you to purchase. I personally tend to prefer a little thicker floss. I find that the thinner flosses tend to cut your gum. So when I'm looking for a nice floss, I look for a thicker floss, sometimes with a little bit of give to it, so it doesn't break or fray between your teeth. Okay, so when we get our floss, I tend to pull out about an arm's length. There are many different ways to hold the floss, and the best thing for you to do is to play with it and work with it yourself at home until you get comfortable with the best way that works for you. Some people like to wrap it between their middle fingers and use their first finger and their thumb to hold the floss, and this is a very effective way to hold dental floss. I tend to use my index finger and my thumb to work the floss. Okay, first we take the floss and work it between two teeth, and then we pull the floss along the side of the tooth in a C shape. You press it down till you feel a resistance. that's the gum line, and you pull up and down the side of the tooth in almost a cleaning or a washing motion to scrape the plaque from the side of the tooth. Always your floss should be moving in an up and down motion wrapped in a C shape around the side of the tooth. We never want to do this with our floss. That can hurt or injure your gum, and it's not the proper way. We want to think of pulling that bacteria out from underneath the gum line and pulling it out and away from the tooth. So we wrap it around the side of the tooth in a C shape, move up and down on one side, and then pull it to the other side, the other surface of the tooth, in a C shape, and move it up and down on the other. And that is the most effective way to floss your teeth. A lot of patients ask me how much toothpaste to use on their toothbrush. You don't need to pile a big amount on your toothbrush. You need to just put a little strip on your brush. It's actually the bristles of the toothbrush that remove the plaque. But toothpaste is important. It has good things in it, like fluoride, that will keep your teeth strong and help prevent decay. Brushing and flossing does take a lot of patience and time, and to learn to do it effectively, I a lot of times tell my patients to watch themselves in a mirror. You can get a magnifying mirror or just a regular mirror, and if you watch yourself for a while, you will become expert at it. Taking care of your children's teeth is very, very important. The primary teeth, which is the first set of teeth that come in a child's mouth, have a job. They are to maintain the space for the adult teeth or the permanent teeth that are going to be coming in behind them. So you must make sure that we don't get cavities in our children's primary or baby teeth. Mothers and fathers, you can take a gauze when the teeth first start coming in and wet it and rub it along these brand new baby teeth to keep them cleaned out. You can also get a very small child's toothbrush with very soft bristles and let them get the feeling of that brush in their mouth, brushing those new baby teeth coming in. What you really have to be careful of are sticky sweets, or if you have a baby, putting the baby to bed with a bottle. When the baby's sleeping, these liquids can pool in their mouth and it can cause, for example, here's a picture of a child with good, healthy teeth. This is a child that might have been put to bed with a bottle or has been fed a diet of sweets, and this is what can happen to their baby teeth. We don't want to see this happen. This is very sad because you don't want to lose these baby teeth. They are holding the space for the permanent teeth. And if you get severe decay or severe problems, it can affect these adult teeth that are underneath that have to last your child for the rest of their lives. Parents, also don't allow your children to suck on slices of oranges or lemons. Oranges and lemons are very acidic and they can wear away the enamel of the teeth, which can also cause problems. It's very important that your dentist and hygienist gets underneath your gum and cleans this plaque that has gone into forming into tartar or calculus, which is causing problems with your gums. If you don't remove it, it can harden on your teeth into what's called tartar or calculus. A lot of you may already know about calculus. You feel this hard deposit that can form on the backs of these teeth on the lower arch here. That is calculus or tartar that forms above the gum. It forms there because we have a saliva duct underneath our tongue, and that saliva pools against the backs of these teeth. And so a lot of times this is the first place that tartar or calculus can form. But it also can get in between your teeth, underneath your gum, form, harden, and that's what starts this process of gingivitis or inflammation in your gum, which can lead to periodontal disease. I'd like to talk to you about periodontal disease. Periodontal disease affects the supporting structures of your teeth. You know you have your tooth, the crown of your tooth, that's above the gum, but a lot goes on underneath this gum area. You have this yellow part here, which is your bone, and it's very important that your bone is healthy. That's what supports your tooth. So periodontal disease affects this bone. And if you do have periodontal disease, you can lose this bone that supports the tooth. And once you've lost that bone, you can actually lose your tooth. So we want to prevent periodontal disease. And how do we do that? Well, we've talked about brushing and flossing, and that is the best way to prevent it. Another way is to go see your dentist regularly so he can take measurements. This is a periodontal probe. He will measure and make sure that you're not losing any bone. So what are the signs of periodontal disease? Unfortunately, a lot of times periodontal disease is not painful until it's too late. So we can start with one sign, which can be bleeding gums. That's called gingivitis. Gingiva is your gum. Itis means inflammation. So gingivitis simply means inflammation of your gum. So if you're brushing your teeth or flossing your teeth and you notice that your gums are bleeding, you probably have gingivitis and you should see a dentist and have that checked. In this picture we see an example of gingivitis. Some plaque has gotten underneath the gum and it's caused this gingiva or your gum to become red, puffy, and inflamed. So it's very, very important to know that if all you have is gingivitis, gingivitis is completely reversible. Good brushing, good flossing, and visiting your dentist and letting them do a nice thorough cleaning will reverse the effects of gingivitis. If your bacteria has been getting underneath for a long period of time, this supporting structure here, which is your bone, can start pulling away, as we can see in this picture, and you've gone from gingivitis into what's called periodontitis. You again need to be much more effective with your home care, which is your brushing and flossing. And again, we need to have a dentist or a periodontist who is a specialist in periodontal disease take a look at your teeth and perhaps do a very thorough deep cleaning to remove the bacteria that has hardened on your root surface. After you have everything cleaned out, you make sure that your home care is good and you visit your dentist on a regular basis. Periodontal disease, again, can set up risk factors for heart disease and diabetes. So once again, it's so important not only for your oral health, it's very important for your overall health to have the bacteria in your mouth under control. To review everything that we've talked about, it's very, very important to brush and floss your teeth effectively. We need to remove the bacteria or plaque from our mouths, not only to prevent cavities or gum disease, but it also helps our overall health. Because if you leave bacteria in your mouth, you can set up risk factors for diseases like diabetes and heart disease. So for your complete health, let's start here and make sure that we're cleaning our mouth properly and effectively.